pregnancies were heterotopic pregnancies. Definition: a heterotopic pregnancy is a rare complication of pregnancy in which both extrauterine and intrauterine pregnancy occur simultaneously. It may also be referred to as combined ectopic pregnancy, multiplied pregnancies, or coincident pregnancies.
Normally, a fertilized egg implants in the uterus, but if the fertilized egg implants somewhere other than the uterus, the pregnancy is said to be ectopic, which means located in an abnormal position. When an ectopic pregnancy occurs, the fertilized egg usually implants in one of the fallopian tubes. Because the fallopian tube is narrow and its walls are thin, the pregnancy only has to be about the size of a jelly bean before the fallopian tube bursts, causing major bleeding. Occasionally, the fertilized egg may implant on an ovary, in the abdominal cavity, or in the cervix. Ectopic pregnancies are rare. They occur in about 1 out of every 60 pregnancies. There are certain risk factors that make an ectopic pregnancy more likely. These risks include a history of pelvic inflammatory disease or PID, sexually transmitted diseases such as chlamydia or gonorrhea, a previous ectopic pregnancy, or a previous tubal surgery for infertility.
Patient of 14 years old gynecologic antecedents right annexectomy for ovarian systems. She is referred to our hospital with the diagnosis of possible ectopic pregnancy and a previous cesarean scar. Clinically, the patient is asymptomatic. Transvaginal ultrasound reports a gestational sac with a 14 mm embryo of cephaloboctalk and positive hairback of the right side of the cesarean scar. Abdominal ultrasound shows the gestational sac in a geometric thickness 5 mm from the bladder. The case and the possible complications with the patient are commented on and due to the lack of genetic discern. The total hysterectomy by laparotomy is chosen with confirmation of the ultrasound findings and resolution of the problem. During the hysterectomy, when vesical uterine decay is removed, the gestational site is relaxed, indicating the imminent risk of rupture. Proofs can be detected in time. You can reconceive counts. Extrauterine pregnancies are not viable and can be fatal to the mother if left untreated. The mortality rate for the extrauterine pregnancy is approximately 35%.
Ectopic pregnancy refers to implantation of the fetal sac outside of the uterine cavity and most commonly occurs in the fallopian tubes. It should be highly suspected in patients who present with severe abdominal pain, positive pregnancy test, and no fetal sac in the uterine cavity on ultrasound. Treatment with methotrexate should be used in patients with a beta-HCG less than 5,000 μ/milliliters and a fetus size of less than 3 cm after confirmation with a transvaginal ultrasound, while laparoscopy can be used in all patients if they have complications with medical therapy. In addition, patients who are Rh negative, regardless of the Rh status of the father, should be treated with Rogaine.
Diagnosis. With simpler, it's difficult for the doctor to diagnose heterotopic pregnancy in its early stage. Women may have vaginal bleeding and cramping, but these are symptoms that occur even in a normal pregnancy. At the same time, it is easy To miss to the pregnancy during routine ultrasound seems to take only the fetus in the uterus and nothing to look beyond that. If there is suspicion of a heterotopic pregnancy, it usually is only believed for five that it can be confirmed or ruled out by ultrasound. Imagine first trimester ultrasound findings in early pregnancy, confirming intrauterine station pregnancy of unknown localization, first trimester vaginal blend. Pregnancy and unusual tip of presentation where inter and extrauterine pregnancy women noticed. Treatment. Ectopic pregnancy is treatment with surgical removal of the ectopic gestation with salpingectomy or salpingostomy. Infection management has been successfully led in a select case. Successful salpingocentesis has also been reported. Swab in Ecuador varies weekly from 1 in 1,002 20,000 pregnancies. Much higher in women who have undergone ovulation induction. Major diagnostic difficulties, Syria will increase the intrauterine pregnancies. Conclusion: ectopic pregnancy can occur in the absence of any risk factor. Heterotopic pregnancy should be a differential diagnosis in pain abdomen with pregnancies. In the presence of bilateral tubal ectopic salpingostomy rated than bilateral salpingectomy is preferable in order to preserve future fertility.